Bobby, RFK Jr. is saying he wants to get people off of antidepressants. Why? What is he talking about? Why are we still in there? Who's he, Tom Cruise?
Withdrawal from SSRIs can be more difficult than withdrawal from. And the New York Times and a lot of other outlets.
So RFK Jr. is getting hit with major backlash again, and this time it's coming directly from doctors who say his latest public claims could actually put people in danger. According to medical professionals speaking out online, RFK Jr.'s latest claims about fertility are careless at best, and they immediately triggered warnings from physicians, researchers, and public health experts who say people are already starting to believe misinformation as fact. And what's making this worse is that a lot of these doctors aren't just disagreeing with him politically. They're saying his comments could scare families away from real treatment and create panic around basic medical care. Some are even saying RFK himself needs to be evaluated to see if he's even sound enough physically and mentally to be making these bold statements about something as serious as healthcare. So now everyone's asking, is this just another controversy that blows over in a week? Or did RFK Jr.'s comments finally cross a line even his supporters can't defend? Because the deeper people looked into what doctors are warning about, the worse this situation started to look.
You know, dentists say that fluoride can help you grow strong teeth. But a guy who does lines off toilet seats and takes raccoon home for further study, he says it causes autism. I mean,
So during a recent White House maternal health care event, RFK Jr. made some very interesting comments about teenage boys and reproductive health that had people doing a double take. According to RFK, teenage boys today supposedly have much lower reproductive health than men did back in the 1970s, and he tied that directly to America's declining birth rate. He even called it an existential crisis, which immediately sent clips from the event flying all over social media. Watch this.
The fertility crisis for women began in 2007. For men in 1970, men had twice the sperm count as our teenagers do today.
And it wasn't just the claim itself that made doctors start sounding alarms. It was the way he framed the whole thing. Because hearing an elderly politician stand there publicly talking about teenage boys' sperm counts while trying to connect it to national decline already sounded uncomfortable to a lot of people online. Then the headlines started rolling out, and that's when the entire thing got even messier. One headline literally framed it as RFK Jr. complains that teenagers today don't have enough sperm. And once people saw that wording, the reactions got brutal fast. Twitter immediately turned into a war zone of doctors, journalists, and regular viewers trying to figure out what exactly he was even basing these claims on and why he was even allowed to make comments like that unchecked. And online, videos mocking that statement started going viral. Even The Daily Show threw a few shots in this clip.
I'm sorry. Did he just do a back in my day for sperm? Back when I was a teen, we had twice the jism. Our spunk knew how to drive a stick, you know? They don't make man butter like that anymore.
But see, that reaction didn't happen in a vacuum either. Because ever since RFK Jr. got into office, he's been backing policies and pushing statements that have already made a lot of doctors and scientists nervous. As y'all probably know, RFK Jr. is one of the loudest anti-vaxxers in the country, which already raised red flags when he was first nominated for the Secretary of Health and Human Services position. And just as they feared, one of his first acts was to order the CDC to suspend its flu vaccination ad campaign. That alone had medical professionals sounding alarms because they felt like public trust in vaccines was already shaky enough. He also blamed the 2025 measles outbreak on poor diet and overall health, and pushed the idea that vaccines like hepatitis B should be viewed as optional for new parents, despite decades of scientific research supporting those vaccines as life-saving preventative care. So by the time this latest teenage reproductive health controversy happened, a lot of doctors were already frustrated with him before he even opened his mouth at that White House event. One of the loudest critics has been infectious disease specialist Michael Osterholm, who warned that RFK Jr.'s messaging becomes dangerous because it often looks credible on the surface. He flat out warned this is about people's lives, because in his view, the bigger issue isn't even RFK Jr. saying controversial things anymore. It's the fact that millions of people are actually listening to him. And after those old clips and vaccine controversies started resurfacing online again, people began looking back at the teenage fertility comments very differently. Now, let's actually get into the claims RFK Jr. has been making, because this is where the situation started getting really messy online. The biggest question people immediately started asking after that White House event was whether count even has a direct connection to declining birth rates in the first place. Now, to give some context, there have been studies over the years suggesting that men's sperm counts may be declining globally, but the bigger issue is that scientists still debate how accurate the long-term measurements actually are, because the data is still too messy for anyone to be speaking about it like it's settled fact. One researcher who studies male reproductive health, Dolores Lamb at Weill Cornell Medicine, even explained back in 2023 that the idea of a global sperm count is an important hypothesis, but the data is not good enough to be able to draw conclusions. And once that quote started resurfacing online, people began questioning why RFK Jr. sounded so certain during his speech. Of course, it didn't take long for people to start bringing up the fact that RFK has had his own battles with heroin addiction, with some wondering if what we're witnessing right now is a public relapse, because some of these things he's saying sound so out of pocket that actual professionals are wondering if he's even in a state of mind to make these claims. And then this clip resurfaced.
Withdrawal from SSRIs can be more difficult than withdrawal from. And the New York Times and a lot of other outlets published a response from that saying that the experts disagreed with the secretary. And we all know that whenever they say trust the experts, they got nothing. But I happen to be an actual expert on this because I was addicted to heroin for 14 years.
When you add that to the fact that his own family allegedly were opposed to him becoming the secretary of the HHS, it starts looking a whole lot weirder. And at this point, things have gotten so bad that some doctors are not even waiting for formal studies or long medical rebuttals anymore before responding to RFK Jr.'s comments. They're jumping straight onto Twitter and publicly questioning how someone making these kinds of claims ended up with this much influence over healthcare policy in the first place. And that SSRI controversy made that tension explode even more. Because as y'all might know, RFK Jr. reportedly floated the idea of banning certain SSRIs, which could affect antidepressants like Zoloft, Prozac, and Lexapro. And the second people heard that, mental health professionals started panicking online. Now, to be fair, medications like SSR absolutely can have side effects, and doctors openly acknowledge that. That's true for almost every medication people take, but they immediately pointed out that these antidepressants have also been studied for decades and are widely considered safe and effective for many patients when properly prescribed and monitored. So to a lot of people, RFK Jr.'s comments came across as very careless. And one person who did not hold back at all was Democratic physician Abdul El Sayed. He went on Twitter and posted this brutal response. SSR are safe, effective, and save lives. More importantly, RFK Jr. has no medical background, could possibly use a psych eval himself, and needs to get the EF out of people's medical decisions. And the reactions to this tweet alone told you where a huge portion of the public stands on this issue, because even people who normally support RFK Jr. politically seemed uncomfortable seeing antidepressants suddenly become part of another culture war fight. And honestly, the sickest part of this entire situation might be the fact that some medical professionals are not even stopping at criticizing RFK Jr. online anymore. At this point, people inside the healthcare system are walking away from their actual jobs because they no longer want their names attached to the direction these policies are going. And once those resignations started piling up, the conversation around RFK Jr. got way darker. One of the biggest warning signs came on February 28, 2025, when Thomas Corey, the top spokesperson for the Department of Health and Human Services, abruptly resigned only 2 weeks after officially taking the position as Assistant Secretary of Public Affairs. And according to reports, the fallout centered around disagreements with RFK Jr.'s handling of the measles outbreak and the messaging coming from the department during that crisis. Things escalated again a month later when RFK reportedly told Peter Marks, the head of the FDA's vaccine program, that he should either resign or be fired. And when Marks submitted his resignation letter, the wording hit people like a truck. In that letter, Marks reportedly accused RFK Jr. of trying to erode public trust in vaccines and wrote that truth and transparency are not desired by the secretary, adding that RFK Jr. instead wanted subservient confirmation of his misinformation and lies. And once that quote started circulating online, the backlash exploded all over again because people could not believe a senior vaccine official was leaving while making accusations that serious. Because now, the conversation has shifted from RFK Jr. says controversial things to why are experienced health officials refusing to stay under him? And honestly, if this many insiders are willing to walk away rather than support these policies, people can only imagine what's being said privately inside the medical community right now. And on top of that, some doctors think the biggest fallout from all of this hasn't even happened yet.